everything went really well. Today we're seeing it's very good. We're very stable. We've actually in the last year opened up 3 new programs that have really challenged the way we run our business. And the way myAvatar was built just allowed us to deal with all of those surprises, at least from the avatar configuration, without really stressing. We built it, and the hardest part of implementing these new programs was all of the human procedures, not the avatar configuration. And now we're billing for all of them. We're able to record all of their documentation, and people are still trying to figure out, okay, now this new requirements come in with this program. There are new programs, newly conceived, and Avatar is just taking it like a champ.
The transition to myAvatar for us was very easy. We didn't do any training at all for the staff who were using Avatar. We did testing for a couple of months leading up to the transition and simply notified the end users that when they come into work Monday morning, they are going to see a different system. And they found it very easy to use. It's very intuitive, very user-friendly. And as I indicated earlier, we didn't do any training on myAvatar at all. We just pushed it out and had the end users just start using it on a Monday morning, and we haven't looked back.
In using myAvatar, the focus shifted from the collection of data and the forms itself and shifted more towards the presentation of information back to clinicians, the doctors, nurses, case managers, or whatever. I mean, it's really changed the landscape of how they deliver care.
From Avatar to myAvatar clinically was almost a non-issue because we had been using Avatar as the basic platform for over a year before we went to the myAvatar. So because myAvatar was largely based on a lot of the same things, it was just simpler and more intuitive in some ways. My clinicians had almost minimal trouble. I mean, we actually designed a training video that several of them came back to me and said, do I have to watch the video? Because I've got it, like I know how to do this. And now instead of going to look for my caseload, it suddenly is in my widget right here in the dashboard. Like there's those kind of things where, from a training perspective, it was a minimal adjustment. If people already know how to use Avatar, it was just very intuitive.
The transition was much more smooth than we ever envisioned. So everything that I had vision of in terms of the simplification to myAvatar for particularly our clinicians, but overall for the electronic record, proved to be right and correct. Not to give me credit, but the team that rolled it out, with a new level of trainings, and it's been not just embraced, it's been loved, and it's worked very well for us.